Hello, my name is Francesca Belibi, and I am a rising sophomore at Stanford University. I'm joined today by my parents, Dr. Franck Belibi, an internist and nephrologist, and Dr. Suzanne Belibi, a pediatrician and allergist. Today we're discussing their experience with COVID-19 here at their clinic. So, can you please tell us your experience and your setting in regards to COVID-19?
Thank you very much, Francesca. We practice in a private setting here at Grace Health Clinic. We primarily see patients in this location, and we see COVID-19 patients on the outside of the building where we have built a shed. The number of cases here at Grace Health Clinic has totaled 70 out of 400 tested since March. In the last week of March, we've tested about 16 patients, and 3 of them were positive. That's an average rate of 18.5%, and we've seen that number go up in April, where we intensified testing, and we reached 23% of positive cases of coronavirus. The peak was reached the first week of May. We reached 25% of positive cases, and then we saw a decline in the second part of May, and down to 10% in June. So it's believed that when you reach below 10% of positive rate, you're controlling the virus pretty well. Now, in the country, we've seen an increase of cases more recently, with cases spiking in Florida, Arizona, Texas, and California. But in Denver, we've been able, in Colorado, I should say, we've been able to control the new cases fairly well. We are still on the watch right now, and we would like to continue to wear masks and maintain 6 feet social distancing.
So in regards to the patients that you've had with corona, what are some of the treatments that you've used?
I would like to say that not all the patients had a treatment. Patients who were sick with symptoms were mainly treated with penicillin binding protein. We use cephalosporins, 3rd generation, as an injection. We also use Tamiflu because it's known to block the exit of the virus from the cell. We've also used Zithromax because in the country a lot of providers are using Zithromax. For patients who had a lot of vomiting, we use Zofran, of course ibuprofen, and we also recommended a lot of hydration in general.
What have you seen to be the outcome of these treatments?
We've had pretty good success in the sense that we've had no death out of the 70 cases we've had. Among those 70 cases, 5, I would say, were hospitalized, and 2 of them were actually in the intensive care unit and were intubated, but they were able to pull out of it. We've also had a fairly number of cases that were asymptomatic. A lot of the patients had respiratory symptoms, but not many of them had fever.
So as you've seen the number of cases starting to rise across the country, what do you advise or recommend as some ways to prevent contracting corona?
I would say that patients who have comorbid conditions such as asthma, diabetes, obesity, or an immune deficiency, for example, they tend to be sick all the time, they really have to get their condition under control. Besides that, wearing a mask is very important because it prevents the virus to deposit on another person's upper airways. Washing hands frequently, maintaining social distancing. And if a patient is positive for coronavirus, even though they might not have symptoms, it's very, very important for them to quarantine because they can infect someone else who has a lower immune system. They can infect their grandparents, they can infect a little baby. So we really, really need to continue to be careful. Also, we recommend that people try to boost their immune system. Children should get all their vaccines. Adults really have to do the flu shot while waiting for the coronavirus vaccine. Take a lot of tea with ginger, lemon, boost your immune system. We also have some products that we have designed with garlic, ginger as a marinade. We also have an immune tea, and we recommend beet juice because it has a lot of vitamin C and also has the property to increase the oxygen level to the lungs.
Do you have any final words, any last things you'd like to say?
Well, we are encouraged by the fact that the rates of contracting coronavirus in Colorado have decreased. We've done a good job wearing masks and practicing social distancing, but it's my recommendation that we continue to be on the watch. We hope that there will be a vaccine soon. Experts are talking about a vaccine being available maybe in January next year. We believe that vaccination may really help reduce the rate in the country. Be on the watch, make sure to practice all the hygienic recommendations from the CDC, and keep in mind that if you don't have symptoms, it doesn't mean you don't have coronavirus.
I would say that we have nothing to lose. The medical community doesn't really have a clear guideline as far as the treatment for coronavirus, but I believe we should, try what we have because the outcome is either life or death. I would encourage, if you don't have a Rocephin shot, you can use Augmentin, you can use cephalexin, you can use even penicillin and combine it with Tamiflu, Zitromax, just a combination that can really attack the membrane and the process of coronavirus. We really have nothing to lose, and we should think out of the box. Besides that, patients and families really have to continue to be careful. As we're talking about reopening schools, I believe that every family has to be careful. We should not send children to school who are positive to coronavirus, and we trust that the whole country is going to be prepared for back to school. Thank you.
You heard it here. Thank you for joining me. Thank you for coming on and talking about your experience, and I hope we can help some people out there in the world.